Good afternoon, everybody. Hi, I'm Brittany. I am a medical technologist and I'm the lab supervisor at Family Medicine Center. It's in Nassau, Bahamas. So today I'm basically going to give you guys a full overview as to how to run the rapid antigen testing, which we all know it'll be the new norm, the new requirement for travelers coming to the Bahamas. Um, so basically, I just wanted to kind of give you like a full step-by-step breakdown. If you have any questions, please don't hesitate to ask. There will be opportunity at the end of the presentation. So please ask as much as questions as possible if it's not clear. So we will get started. So we all know that the antigen testing is basically a screening tool. It is a diagnostic test where we will be testing for the COV-2 antigen. So ultimately, the nasal swab that we'll be using, we'll be collecting the sample, and then we will be using that to do our testing. It is extremely important that we ensure that the integrity of the sample is at its optimum, because that ultimately will provide us with the most accurate results. So I want to make sure that I show you guys and explain to you the full breakdown, so that when it's time for you to actually do the testing, we are providing quality results, because this is obviously, we're in a pandemic and we need to make sure that we are providing the best care. So I will start by explaining that first and foremost, we have to be very cautious of our personal, we have to be protective of ourselves. So the main thing for all of us that we need to focus on firstly is the PPE, which is the personal protective equipment. I know that this will be provided with you guys along with the kit initially, but you have to ensure that you'll have an N95 mask or KN95 mask. You'll have a gown. It's folded up. And I will put all this on for you guys shortly, and a face shield. And these stuff are basically to protect you more so than anything else, because obviously we don't want any of this to be taken home to our families. Also, of course, gloves. Every patient that you do, the recommendation is to switch gloves for each patient. So let's get to the kit. So this is the kit that we'll be all using. All of you, if you haven't received it yet, you'll be receiving it by Friday. It is the standard queued COVID 19 antigen kit. The components inside of it are the swabs, which I will show you. There are a extraction buffer tube. So it's inside of this packet, which I'll show you. It's this little tube. The actual test cassette, this is where you'll be performing, and you will be adding the sample to this, and I will obviously show you that as well. You will have a nozzle cap to actually get the sample onto the cassette. And then also for anybody that will be doing any testing outdoors, there is they're like a window film, which you use to kind of protect the cassette. You will cover this with the cassette once you add the sample, and this is going to protect the integrity of the sample on side of the cassette, because we don't want any dust or debris to get on side of it. But all of that is in the kit, and there's a full explanation on how to use everything, and there's also full description and explanation as well. So without further ado, the best way to obviously explain is to show. So I have my assistant here who's going to be our testing buddy. Her name is Ashley, and we are going to get started. So Ashley's going to take a seat over there. So I'm going to switch over cameras. So just bear with me for 1 second.
Brittany, can you put on the PPE?
Yeah. Here. Yes. Yeah, this is better. This is a better camera. Correct. Perfect. Oh, yeah. So let me do that, because this is a better view. So first, I will put on my KN95 mask. There has the piece at the top. You squeeze your nose. I will then put on the gown. So I'm going to stand up so that you guys can see it better. Give me 1 second. Ooh. So it's kind of like putting on a jacket, but backwards. Ashley, do you mind tying me up? Mm-hmm. You're short. Yeah, no. And then lastly, I'll put on the face shield. So there are different types of face shields. Ultimately, the main concept of this is just to cover your full face over the mask. You must wear a mask as well as wearing this. You can. I know some people just wear the face shield. That is not acceptable. We have to ensure that we're wearing both because we don't want any type of particles to get anywhere inside of your face or to get anywhere near to your mucosal membranes. So both of them are a requirement. Okay, so I'm going to switch over cameras. Give me 1 second. So before I get started, sorry, let me just so you can hear me better. Before I get started, I think the most important thing is that you kind of have everything laid out so that you have access to it and everything kind of moves smoothly. So what I'm going to do is I'm going to just kind of lay out all of the contents right next to her so that they're all accessible and it's all easy and it goes smoothly, because you do not want, as soon as the swab comes out of her nasal passage, you must immediately put it into the buffer solution. So I will do that first, and then I will proceed with the collecting the sample. Also to add, sorry, I'll put this so you can hear me, to add, it's very important to also have a biohazard container nearby so that once you're ready to discard the swab, you have somewhere to put it immediately, because it cannot be put, can't sit onto the side. It has to be discarded correctly in some type of biohazard container. Okay. No, you're good. So I'm going to put on my gloves. So I just want to also mention, so this is the cassette. I'm going to open up the foil packet. Inside, this is the cassette. And this portion at the bottom is where you would put the sample. So once I take the nasal swab out, I will put it into a buffer tube, which I will show you, and then the sample will go right down to there. So I'm just going to show you guys. I took it out. It's always better to do it in front of the patient so that they can see that this is a brand new cassette, and you just kind of keep track of each patient that you're collecting a sample from. This is the buffer tube that this nasal swab will go in, so I'll show that shortly as well. And then this is the nozzle cap, which I will also show how I will be using this. 1 second. Okay, ready? Okay, so you move here, but you can bring it down. I will have it next to you. Okay, so this will be the swab. At the portion it says peel here is where you will open up, and you'll have the end of the swab there is where you will touch. So I just want to mention that these swabs are thin at the beginning and then it thickens. So my recommendation is to use that portion. There's a little groove that you could usually use as your marker. So the thin portion is as far as it should go up the nostril. It shouldn't go any further. That's how you could kind of gauge how far you are inside of the nasal cavity. And then once you get it inside of the nasal cavity, you turn it for about 10 seconds, and then you slowly remove it. So I will do that right now on this patient, and then you'll be able to see how this works. Oh, yeah. Mm-hmm. Also tissues, because the patient probably will tear up and they may or may not cough.
So it's always great to have two. I'm gonna actually sit inside of this. They actually have it's like a little well, so that when you're ready to put it in, it's standing up and the buffer solution is not gonna spill out. All right. Slowly out, perfect. I immediately will put it inside of this buffer solution. Bless you. You spin it down for a little bit inside of there. There we go. And then I will squeeze and squeeze all of the contents out of the, sorry, let me back up, out of the swab. Out, it's still in here. Throw this away, discard. Okay. Yeah. And then I use this nozzle cap connected to the top of this. It fits perfectly in there. Okay. This is the cassette. I'm going to drop 3 drops inside of the well. 1, 2, 3. And I will discard. I also need to discard this into a biohazard as well. So discard this. And then it'll wait. So this is what you'll see. I'm going to tip it so you guys can see it better. It's starting to move up. So a control, move this down a little. You must have a bar, it will be a band to the control line for it to be valid. If there is no band at that control line, that means the test is invalid and you have to do it all over again. So you have to ensure that there is a colored band at the control line. And then if there's a colored band on the test line, that means that there is a positive result. If nothing shows up on the test line, then it's a negative result. So it takes about 20 minutes. So you'll set a timer. I see the time, so I know that in 20 minutes I'll check. And then you just kind of sit and wait, and then you can proceed with your other patient. So I'm going to show you how I take off all of my PPE once all of this is done. 1 second. You're welcome. The T is no, oh yeah, it comes up positive. Okay. So first, what I'm going to do is I'm going to remove one of these. I'll use the same exact glove, and I'm going to use this, touch this, not my skin, touch the glove, take that off, discard. And then what I'll do is at the back, I usually use like the back of my gown, and I just rip. So these ones are so easily to be ripped, like they could be ripped off of you easily. They're literally like a t-shirt. You could rip off, take off, and then you throw this in a biohazard bag. And then you could remove this easily. And then that's it.
So at this moment in time, so you're waiting for your result. It's very important to, not have it on a flat surface. Like I said, if you're at an outdoor place, it's always good to use the window to cover it so that it's not, no debris or anything gets over inside of the sample. And that is about it. You get your result as early as 15 minutes. And as maximum is 30 minutes. Anything over 30 minutes is invalid. So I would say that about 20 to 25 minutes is a good amount of time to check for the result. And that is about it. Does anyone have any questions?
Hi.
Hi.
When you was talking about the test band, it kind of cut out for me. Can you please explain that again?
Sorry, say that one more time.
When you talk about the test band, to put on the test.
Oh,
I didn't hear that part.
You mean the results?
Yeah, so.
Oh yeah, I'll show you. The cassette has a C, which is for a control line, and a T for test line. So the control line is basically, it's kind of like quality control. It's like a QC. So it basically tells you that the integrity of the cassette is at its optimum, it's perfect. So it's good to be used. If the control line has no band, that means that it is invalid. It will not work. That's what I was saying. So the T line will basically tell you if the patient is positive or negative. So at the moment, there is no band. So, but obviously it's not ready to read as yet. But if a line does show up at her T portion, that means that she would be a positive for COVID antigen. If it's negative, if there's no band at the T portion, that means that she's negative for the COVID antigen. Does that explain?
Yes, ma'am. Thank you.
Problem. Any other questions?
Yeah, did you do 2 nostrils or just one? Because I wasn't able to see, sorry.
Yeah, so it's only one nostril is required for this test. We only have to do one sample, one nostril.
Okay, thank you.
No problem.
Does it matter which nostril?
No, so honestly, what I like to do is I ask patients what they would prefer. Sometimes, like if this is not the first time that someone's had this test done, and they may have had a little trauma before, they tend to ask for the other nose. If they've ever had a broken nose and or deviated septum, so it's always good to ask because a lot of people have they've gone through different medical procedures, or they might have sinus issues, and they might have a preference. So I think it's better just to ask whatever they're more comfortable with.
The question was, does the person have to be seated to do it, or if this is for standing up?
So you mean the patient or the actual tester?
Patient.
My recommendation is for seating. So for us, example, at our Family Medicine Center, we're doing drive-through services. So all patients are sitting in their vehicle and we're just coming to their car and they're sitting down. I find it to be much easier if they're sitting because you're able to and have their their head tilted back that way, that it's easier to kind of get the swab inside of their nose. So I mean, I'm sure it could be done standing up, but I think it's better for you as the tester to be standing and for the patient to be sitting.
How far do you recommend that you stick the swab into the nose?
So the swabs, though, so they're actually, I like how these ones are designed because part of it is it's skinnier than the other part. So it starts off skinny and it kind of expands and it gets a little thicker. So what I use at the end of the day, everybody has different, nasal, structures. So some people's nasal cavities are shorter than others, but it seems that because it's the thinner portion is going into the nasal cavity, it seems that if you can get up until the end of that thin portion, then that should be sufficient based on this package insert. They said that once you're able to get the thin portion as much up into the nose as possible, it should be a sufficient amount of sample. And also I need to note that once you do enter, you don't pull out automatically. It has to be into the nose for about 10 seconds to allow for it to saturate the swab. And that way you're able to get as much sample onto that swab as possible.
Okay, so with the sample, what if we have a patient that has allergies or is on blood thinners and they have maybe a small nosebleed? What should we do?
So I know, for example, that if you have a patient that is prone to like cold or they have allergies where they're sneezing or they have a lot of congestion, they do recommend allow them to blow their nose first, then proceed with the sample. Now, in the event that if they get a nosebleed during the test sample, I do know that according to this, that there is no, I would hope the blood doesn't get on the sample, but in the event that it does, it should still be, as long as it's in there and it's saturated, it should not affect the results at all. I did look into that because I wanted to see what are some ways that the results can be affected. And obviously, yes, some people do have nosebleeds and, you have to take into account. And they said that according to this test, it should not affect the results, as far as I know.
My last question, if we do allow the patients to sit in the chair, should we sanitize the chair afterwards?
Absolutely.
Okay.
Absolutely, I would. And that's why, yeah, absolutely. I would sanitize. If you're switching out with people inside, I would have a spray solution bottle and just spray it after every patient just to ensure that the area is completely clean for the next person.
So that is removing the gowns through every patient, or?
So no, the gowns do not have to be removed every single time. The only thing that needs to be changed on a regular is your gloves. Every single patient requires a separate set of gloves, but your gowns, you do not need to. Unless you're, if you're going to do testing continuously in a portion of time, then you keep the same, but obviously once you leave that testing area, you need to remove your, everything. And then if you have to go back to the testing area, you'll have to just regown.
Thank you.
No problem.
What if a patient wants to do the swab themselves? Would you let them do it?
So that's a good question. So personally, I think that I do know that in certain countries they do allow patients to do their own testing because of this antigen testing, and because it is not because it is a screening tool. Yes, it's like an 85% sensitivity, and it limits false negatives because of it. I would say that it's better for a person that is trained to do it themselves, because that will eliminate, obviously, if you have somebody that is not familiar. I think personally, if I was doing a swab on myself, I wouldn't go as far up as I should. And I think I wouldn't be in there trying to get as much sample as possible. I think it's very important that a trained professional performs this test. I don't think, because if it was a PCR test where it's about 100% sensitive, 100% specific, then, the sample integrity won't be affected as much with the result. But with the antigen testing, it's very important that we are doing this to the best of our abilities, because the antigen test has a lot of, it can have a lot of false negatives, and that's what we are trying to avoid. So my recommendation is, if you are a trained professional, should perform these tests. Absolutely.
Well, so you say trained professionals, so like me or Faye here, that has never done it before.
No, but I mean, but you're doing a training session. So anybody, meaning like somebody that's actually done like training and knows what to do. I mean, obviously, when I first started, I wasn't a trained professional either, with it. But once you, the fact that you're sitting through this and you're actually learning and actually understanding the whole breakdown of everything, you ultimately, you are a trained professional now.
Yeah.
so yeah, I definitely say that. Yeah, you need to be
because exactly of what you said before. We have a customer that comes here and says that when they do their COVID and they get PCR, they give them the swab and they do the swab themselves.
Right. Yes,
which would make it so much easier for us, of course, but.
Exactly. I know. But the PCR testing is so specific. It's so sensitive. So that, the chances of anything, any false negative is very slim. It's very for that. But for antigen testing, it's higher. So we have to be more conscious of how we go about the testing process.
Thank you very much.
No problem.
Do you have questions?
If they have places that you can write the names, like
the
names.
What happened after the test is done and when it's.
So here, I'll show you this. On this cassette portion, there's a very tiny little space where, because obviously you're not going to sit down and you're not going to have for some people it might be continuous testing. So you can't just sit there and watch every test. So there is a little portion above, if you see right below the AG, where you could put a last name and you could put a date of birth, because that's very important. You need to know exactly who you're testing. Obviously, if it's like one person at a time, every hour, every 30 minutes, it's different, but it's very important to have like a name and a date of birth.
So Brittany, I'm just gonna intervene there for a second. So we are actually sending QR codes that will match into the system to a profile. So you would scan the QR code with the tablets that we've also sent. And that QR code will match to the traveler's account.
Okay, that's what I had understood.
You would stick the QR code on the test before you administer the test. It'll be linked to that passenger, and then it's all cohesive. So then when you go back to read the results, you scan the QR code for the test, the traveler's profile will come up, and then you will mark either positive, negative, or invalid.
Don't you have to scan their health visa? Their health visa, isn't there a QR code on that you're supposed to scan?
Yes.
To match?
Yes, so we'll be sending a platform training video as well. This is specifically just the test.
Okay.
So what happens is the traveler would walk up, you would scan their QR code, then you would scan the test QR code, administer the test, and then the traveler would proceed to go through immigration and customs. Then once the test is ready, you will scan their test back. Their profile will come up and you would mark positive, negative, or invalid.
And you have to let Custom and Immigration know after that?
No, so you just go into the system and just upload it to there. Once if somebody does test positive, those results are sent to the Ministry of Health, the Ministry of Tourism, and then to the person themselves. So they're all, everybody is notified. And then from there, the COVID-19 ambassadors and the Ministry of Health are able to do contact tracing.
Okay.
So, Andrea, if you could repeat that for me, that wasn't so clear.
Yeah, sure.
Okay, so the customer comes in, he would have already uploaded and have his code with customs when he comes in.
Yes.
So what you're saying is when he comes in for me to administer the test, I have to would it go online? The system is online, right? Where we
Yes. So we have sent to the ports of entry and marinas and hotels up to this point. We have sent packages with their initial tests. That includes PPE that Brittany went through. And then from there, we also included a tablet, which on the tablet is uploaded the platform already. So all you have to do is turn it on, connect it to the Wi-Fi box, which is also included. And then when the passenger comes in, they would pull up their confirmation code from the Bahamas Health Travel Visa. You would scan their code, then you would scan the QR code that will go onto their test. You will administer the test to them, and then they will be free to move. So then they would go through the customs immigration process, then they would go directly to their hotels or residences, because this includes Bahamians as well.
Okay.
So then from there, once the go ahead.
You scan that with the tablet?
Yes.
Okay, so for administering on the 5th day, well, I'm a hotelier and, learning this to administer for my guests who stay, because we have a good bit of guests that stay 5-7 days. So I would be provided with this tablet as well. So I won't be the initial. So then all of this will be in the system. And once I scan the code from the test, I'm going to give.
So this applies for the 5th day travelers as well. They would pull up the same confirmation code. You would scan their code and it would be the same process, even though you were testing on day 5.
Okay.
So they would pull up their travel visa confirmation. You would scan the same code. It would pop up in their profile. You'll see their results from their arrival test. You would scan the QR code, administer the test, and then you would enter their results for day 5.
Okay.
Does that clear your question?
Yeah, it does. It does.
So like I said, we'll be sending out the recording of this video as well as another training video for the test administration and then the test spec sheet all in an email, but then we will also be sending the platform itself. We'll be sending training for that.
Okay. So we got 3 or 4 more sessions to go.
And hopefully just one, but yes.
No.
Brittany, I have a quick question.
Brian.
My father had unfortunately had a botched COVID test at Doctor's Hospital, and it didn't lead to good things. Let's just say that. I'm wondering what the complications of this test, or the common complications of this test, are that I should look out for. I mean, he got a nosebleed that then found out that the tester nicked an artery. And you've called me a trained professional. I'm now a trained professional, but not that professional. So
Understood.
I'm wondering what I should be looking out for.
Understood. That's definitely a great question. Honestly, you know, at the end of the day, this is not a very comfortable situation for anybody that has to get this done, obviously, but this is the, you know, this is the new normal at this point in time. So I think it's just important. I just, you know, I've been training a lot of people here, and I've just been letting them know, just the key is go slowly and just be as gentle as possible. Like I said, you know, now I will say that this swab is a thinner swab than the swab that's used for the PCR testing at doctor's hospital. I know for a fact, and I will say that the chances of I guess of any type of issue up there should not really be as common with these as like it was with the thicker swabs. However, anything is possible. I just think that it's just very important to just be slow and gentle. And if anyone, so for example, today I had somebody that I did performed, and she had an anxiety attack because she had an experience at another facility, and it just kind of, it scared her, and she was just like, it was such a horrific experience. And you know, you just got to give them time. You know, obviously this is not something that people want to have to do on a regular. I stepped back. I told her, you know, I'll give you a few minutes whenever you feel ready. And you know, once she felt comfortable, I was able to proceed with the test. But you know, I wouldn't rush anything. I would allow people to, you know, give them time to, you know, catch themselves, because if they move, that causes a problem as well. So if you feel like you're about to enter their nose and you feel like you start seeing heads moving around and any type of movement, don't even enter. I would just, you know, make sure, keep the swab out of their nose, give them some time to catch themselves and give them some time, and then you proceed. But I think it's just very important. This is not, you know, obviously I know certain places they're doing about 100, 200, 300 a day. So they're just they're moving. So, but the important thing is to take your time and just try to be as gentle as possible. And I think once you do that, you will be successful with this, trust me. And obviously if you haven't done it before, definitely the first time is going to be a little nerve-wracking, but just, you know, allow yourself just to kind of take your time, and it'll definitely work out. I could assure you guys of that.
Okay, second thing, this, I know for the PCR test, since his experience, he has refused any nasal PCR test, and it's possible to do a throat one. This, obviously, this does not have that possibility.
Nope. So this particular test only is a nasopharyngeal for nasal cavity. It's the only way. So that's the, there's no throat option and there's no blood option. So yes, this is the only option.
All right. Thank you.
No problem.
So
Can I
thank
ask
you,
one last
everybody.
question?
Oh yeah, sure. Go ahead.
Yes. When we receive the kits and everything, can we use a few of them to practice on ourselves among us, like 2-3 times, just to make sure we're doing the right thing?
I would say you could practice, but I wouldn't use an entire box. I would say maybe
Oh,
one,
no.
two. Yeah, I would say a
2-3.
couple. I would say
Yeah.
a couple, just so to make sure that you're comfortable.
Yes.
But like I said, like once you do one, I think you'll be pretty comfortable doing it.
Okay.
I've tested myself a couple times over the past week or so, so it's very easy to administer. But yeah, so any more questions before we?
I just wanted to show you guys, it's the 15 minutes that did pass. So I wanted to show you the result of this result. So it came up as negative. So as you can see, there's no line at the T portion and there's no line at the C. Also, I want to mention that a faint line is still a positive. So if you do see any faint, anything faint, that is a positive result. So if there's anything present, positive. If there's absolutely nothing there on the T line, it is negative. So just wanted to show you that.
Perfect.
And that's it. I hope you guys, I hope this will help a little bit. The best the best experience is hands-on experience. So once you your first patient, you will, after that, it'll be seamless. Trust me. So I hope you guys enjoyed the talk today.
Thank you so much, Brittany.
No problem.
Very good. Thank you so much.